welcome to this meeting on realising patient and NHS benefits from health and care data from policy to practice. So welcome to those of you in the room and to the many people to whom we're live streaming this event. So this meeting has been convened by CASMI, which is an international and interinstitutional collaborative network committed to advancing sustainable medical innovation that is hosted by UCL and supported by the UCLH BRC. The Academy of Medical Sciences, in which building we're pleased to be. The Academy is intensely involved in public and patient involvement and engagement as it relates to medical science, and was the producer of the 2018 report on our data-driven future in healthcare, which places partnership and people at its heart, and that's an important theme for this meeting. And then the third component of our group is Health Data Research UK, the National Institute for Health Data Science, which, as you're all aware, has the mission to unite the UK's health data to enable discoveries that benefit people's lives by improving access to large data sets and analytics in a manner that is transparent with a commitment to earn public trust. Now, as you're all aware, this is an area that is intensely topical, and it's great to have so many here, and the fact that we've been oversubscribed and have a big audience here subject to live streaming is evidence of that. There has, as you know, been a plethora of guiding principles and important work on policy, much of which is referred to in the pre-read material that you will have received. And there are, of course, new structures being created, for example, the Office for Life Science Centre of Expertise on Health Data Benefit Realisation, and the new Centre of Expertise being created by NHS, which will provide specialist commercial and legal advice to NHS organisations entering data agreements. But what I suggest we need are practical interpretations of those policies and principles so that all involved know what to do and what not to do, and more importantly, how to do it, and the public can scrutinise that which happens in practice to ensure it aligns with agreed principles. Inevitably, that translation from policy to practice will result in mistakes, and we must accept that if progress is to be made, and commit to transparency and learning from experience. And I see today as part of that journey. Many have referred to data as the new oil, an asset that will shape not only our societies but our economies. Now, the analogy works insofar as the potential value of both is immense, and in the case of the UK's NHS, comprehensive longitudinal patient-level data set covering perhaps 65 million people, particularly so. But in contrast, oil is a finite commodity, whereas data has no bounds. But a more crucial distinction as regards health and care data is that it derives from us as individuals, not land ownership or drilling rights. It's absolutely essential, therefore, that society, individually and collectively, owns the approaches adopted to realising benefits for the NHS and patients from healthcare data and its analysis. And we've structured today's meeting with that in mind, with part 2 of session 1 in particular providing an important backdrop to all of our discussions. As we move through the day, we'll begin to integrate practical experience of broaching these issues, and in particular seek to benefit from the early experience of the 7 Health Data Research UK digital innovation hubs. Launched in October last year, they will, I'm sure, provide valuable insights as to recommendations and indeed unresolved issues as they strive to fulfill their important remit. Finally, we'll bring all of our deliberations together to inform the development of a practical framework for implementation, identify where future work is needed, and a timetable for resolution of outstanding issues.